So today I'm going to do two things. I'm going to talk about cardiovascular disease in women's health, but I'm also going to merge that and bridge and talk about undergraduate research and how students are getting involved in this project, literally leading the way, and then maybe encourage some of you all, if you are not involved currently in undergraduate research, or if you're a graduate student, then you are involved, but how to take that to the next level to extend what you're doing out into the community as well. And so scientists searching for a cure. These are my students who are the scientists. And CURE is an acronym for course-based undergraduate research experiences. And particularly, we're going to talk about this next generation and preparing them for leading the way in cardiovascular disease. So which of the following do you think women die from the most? A, breast cancer, B, heart disease, or C, Alzheimer's? What do you think? It's between A and B, because we know those are two that we hear about all the time. What do you think? Cancer or cardiovascular disease? Who has the highest? What do you think? Yeah, of course, yeah. So yes, so heart attack, stroke are the leading cause of death worldwide, and not just for women, but also for men. And so what is heart disease? I won't go too much into a science lesson, but I want to be sure we're starting off at the same point. So it can be multiple things. So your coronary arteries, and I'll show a picture of the heart moving, but literally, if you can think about a small little pipe and where the blood has to flow to get to other parts of the heart as well as your body, that artery can sometimes become clogged. And if it becomes clogged, you have what we call a myocardial infarction or heart attack, because if it's clogged with like cholesterol, plaque, any kind of buildup, it's going to block the blood from going through, meaning you don't get your nutrients, your oxygen, or anything, and that part of the heart will end up dying. Also, hypertension is not necessarily heart disease, but it leads to heart disease. And so when you have high blood pressure, those arteries will constrict really tightly and also makes it difficult for the blood to go through. And now you're trying to push through with so much force that your heart is overworking even more. So that's the main aspect of heart disease that we hear about. But there's some other things. Heart failure occurs when you're at the end and the heart capacity to pump and to provide nutrients is at its final part. Arrhythmias, the heart it's beating. And so when that contractile state and that beating of the heart is off, it's not within rhythm or sync, that can also be a problem. Congenital defects, and then vascular disease. You can also have some defects at birth, so you can see that in infants, but then also the valves, and I'll show a picture of the valves. They allow the blood to pass through, so it's like a opening and closing type of situation, and if it doesn't do that properly, you don't get the amount of blood that's needed to go through. So here's a picture of the heart in the valves. And this is normal. So you can see just that rhythmic flow and how everything is coming in, going out, and you need those valves working. Also, look at some of these other structures. So this is sort of the big muscle of the heart. So you can see how it's contracting, and it needs to do it with a certain amount of force so that the blood can go out. This red part here, it's going out to the rest of your body. And then here you have it coming in where it needs to be oxygenated to go out to the rest of the body. In this next slide, look at the shape. See how the heart is shaped differently? This is a heart that's dealing with some type of failure or some heart issues. And so now look at the gap that you see there so that your blood flow is not moving the way that it needs to. This is just one aspect, but the heart becomes dilated. You can see how much thinner these walls are on the side. You could even, if you measure the time that it's taking for all of this to happen, that could be off as well. And so what we do in my lab and what my students work on, we use animal models to be able to mimic this, but we examine how this looks in a mouse heart, which is not exactly the same, but it's the closest that we have in terms of its genetics and how it relates to humans. But we study this physiology. We study the structure, how those walls will change. How does the blood flow patterns change when we have female mice that have lost their estrogen, that are aging? All those different parameters we examine to get some kind of idea that in women, as they age and go through multiple changes throughout their lifespan, how does these things impact their heart? So the students are working on this and answering some really great questions. All right, so some of the risk factors: high blood pressure, I started to talk about that. Cholesterol, so your diet has a huge impact on cardiovascular disease. Smoking, diabetes, and obesity. So some students are looking at the obesity part in cardiovascular disease in a research question. Physical inactivity, alcohol, and even family history can play a part in those things as well. So here is probably the most recent graph from the Centers for Disease Control of the dark areas means high density of cardiovascular disease. And so what do I have circled with the arrow pointing if we know our geography? Where is this? Yeah, it's East Tennessee. And so when you look at the map overall, in the southern portion of the country, you can see that it's highly populated and dense. And so states like Tennessee, Mississippi, Alabama rank really high in cardiovascular disease. And then particularly if I look at that map of Tennessee, you can still see here in East Tennessee, we have a high burden of cardiovascular disease as well. And then this is the most recent when I look at it by women. It's not too much different as well, but you still see a high concentrated area. Now men do suffer more and have a higher mortality when it comes to cardiovascular disease compared to women. But some of the differences is that as women age, you see a sharp increase in cardiovascular diseases, cardiovascular incidence, and it's going to be around that menopausal transition, around the ages of between 50 and 60, you see some serious changes in their cardiovascular disease. We won't spend a lot of time digging into those comparisons between males and females, but I just want to point out that men still do have a higher burden of mortality when it comes to cardiovascular disease. But it's those sudden changes that we see in women with the decline in estrogen and the lack of research on the issue, which makes it a serious public health problem for women in cardiovascular disease. And so here is just some data. The differences are not well studied, and even now with all the current technology that we have, there's still some gaps that need to be discussed. But you got 1 in 3 women will suffer from cardiovascular disease as well as die. And so these numbers are still not great. When I just think about hormones, and when we're talking about women, and one of the main differences when we think about biologically males versus females is the sex hormones, in addition to some of the anatomical things, but the sex hormones are what we'll be focusing on. So your hormones like estrogen, progesterone, and testosterone, here are some of the effects that you see happening particularly in women. So the metabolism, your brain, your heart, your bones, your entire body is regulated in so many different ways by these hormones. So imagine having that gradual decline and then an abrupt stop of estrogen, and you've had this hormone your entire life, and all of a sudden you do not have it, but you still need to function in all these capacities of cognitive, cardiovascular health. You need excellent bone health. And so imagine what it's like and the physiological changes that occur in a woman's body when now it's depleted of estrogen. This is currently, so this month is red, go red. And so they encourage people to wear red to talk more about cardiovascular disease from the American Heart Association. And so this is their latest campaign or draft that they have about menopause and heart health. And so menopause, as I mentioned, is a decline in estrogen that all women experience, and you also can have what they call early menopause. And so if for different types of health reasons, if a woman has her ovaries removed prior to that age 40, 50 mark, then she would be considered in early menopause, because if you remove the ovaries are responsible for producing estrogen. And so something that our lab is interested in those cases specifically, when women have those surgeries where they have an ovarectomy early in life, what are the consequences in terms of their cardiovascular health, and what should be done if you're 30 and now your lifespan can go to 80, even 90. And so you are 60 years now without your estrogen. What are the consequences, the impacts of that on, for us, cardiovascular health, but even other types of health? And so this is sort of a timeline, and it varies. And so you can late 40s, but mostly the early 50 mark is where women begin to see this decline in their estrogen levels, and to a complete stop by mid 50s. But it can vary. It does. It really varies from person to person. Environmental factors, perhaps whether that individual had children or not, but there's so many different things that can impact that. And so I've already mentioned two major things that this estrogen loss can have an impact on: the heart as well as bone health, and maintaining that. And then here are some things that can be done ahead of time, but also while going through menopause, to be able to mitigate that. All right, so here is sort of the importance of the why. So why do we have these gaps that I'm discussing now? Why is there a lack of research? And so I'm going to go through a timeline of advocacy in women's health. So the Framingham study started in 1948 was sort of the first kind of original study to begin to look at some sex differences between men and women, and hormones, and how they may have an impact on cardiovascular health. Here, so the Federal Drug Administration, the FDA, as early as 1977, had a policy in terms of the inclusion of women in clinical trials, saying that due to perhaps birth defects or any other issues, that women of childbearing ages, whether you were pregnant or not, but women of childbearing ages should not be included in clinical trials. And I'm going to back up a bit. Anybody could tell me, what are clinical trials? Why are they important? Tell me, what are clinical trials? Anybody knows, what are clinical trials? I know. Yes.
During a lot of the manufacturing of medicines and procedures, it's mostly tested on animals. So clinical trials, the way for them to see how it affects humans more than just what they observe in animals.
Yes, exactly. So testing out these medications before they hit the market and actually are available for humans. And so what would be the importance of having a diverse, even though that's not the whole part of this talk, but having a diverse population of participants in these clinical trials? Somebody else? Yes, so you get more data and impact everybody. Because if you're designing these drugs are going to go to where? Everyone. If you're developing even a treatment, that could be a device, or how a particular device might work to assist with heart disease, it's going to everyone. And so you need a representative population of persons in clinical trials so that you can see how it's going to impact. And so if the trials include mostly males, then how do you account for some of those differences that males and females just naturally have? And do those differences have an impact on how the drug will behave in women? So that was a huge concern, but in 1977, they could not be included. But in the 80s and the 90s, and that wasn't that long ago, every time I think about it, I'd be like, I was born in 1979. That's not long. But in these 80s and 90s, you begin to have advocates to say, no, there needs to be some change. We need to have more inclusion of women in these trials, so that we can have better information about not just drugs, but just how, like I mentioned, certain devices, treatments, anything related to healthcare. We need to know more about it. 1991, the NIH, the National Institutes of Health, had a women's health initiative. This is a really, really big study that began to look at menopause. One of the things that came out the study is that they had to actually pause the study, was that they were giving women back estrogen. And so you're going through menopause and say, okay, well, naturally, let's give them hormone replacement therapy, because then this should fix the issue in terms of heart disease and a few other things. But what they found was that no, it actually made it worse. So supplementing the hormones back to women, they actually pulled the study because women were getting having high risk factors. Some women were developing breast cancer. But in that, the way the study was designed, one of the things that was not closely, was not considered was the timing. And so that's something that we study in our lab, but the timing at which you give the estrogen back. So if you have a woman who is 50 or 55 going through menopause, and then you start hormone replacement therapy, versus a woman who may be in her 60s and you've been without your estrogen for 10 years, versus maybe this is year 1. That time period makes a difference on how the body is going to respond to the hormone treatment, or even other types of diseases, cardiovascular disease as well. And then particularly cancer, because breast cancer responds to estrogen in a not so great way as well. The 1993 NIH Revitalization Act, so from beginning of time, 1977, to now, 1993, they were beginning to say, okay, we need to reconsider some things and how we are allowing women to participate in clinical trials. What are some of those parameters, along with other things in terms of having a diverse pool of participants in clinical trials. And then 2016, so I was done with my graduate training. She mentioned 2007. And so when I started having an interest in this topic, it was maybe about 2009, 2010-ish, maybe, when I was a postdoc working on something else. But as I was finishing up my postdoc in 2011, my mentor gave me this project and said, hey, this is something we had started, but we don't know where to go with it. Maybe you should think about it. And as I started to look more and think more, it kind of was on pause for a while. But I'm thinking about, man, even when I started getting into this type of research, you did not have to, in your animal studies, so you mentioned sort of the preclinical animal basic science studies, a lot of studies were done with male mice. And you could publish that data, and it takes you to the next step of thinking about clinical trials without even using female mice, which is easy to do. So now it's a requirement that when we apply for grants, when we're doing research, when we're publishing papers, we have to discuss, did we use or consider sex as a biological variable, meaning that we use male and female mice in the study. And our lab studies particularly female mice, but we also are doing work in male mice as a comparison as well. And so then here are just some additional studies where we're looking at aspirin and heart disease. I talked about the hormone replacement therapy, and then now I mentioned the American Heart Association has this huge campaign in February to bring awareness to cardiovascular disease in women. So long, and I could even go back prior before that, but that was that 1948 period till now is kind of when action began and began to realize. But really around the 1990s is when you started to have policy mandating that you have to begin to consider women in these studies and how these differences do have an impact. Okay, So leads me to the why of my research and the why of me training students to do this. Because this is the next generation, or you all are already here. And so now you are going to be in a position, no matter what your field is, to make decisions about policy, whether it be the work that you do informing the policy or whether you actually sit in the seat and you're at the table making the actual decision about the policy in any area. And so that's why this is important for me in having students engage in this research. And so what is a CURE, or what is a course-based undergraduate research experience? Particularly in the sciences, this has become a really standard practice of getting lots of students involved in research. But any field could do this. And so essentially, it's where you have a class and students are working on an authentic research experience. So if you're in the social sciences and you have a research question, or your professor has a research question, and you are in a class, the professor can design the class in such a way where the students are asking questions, participating in the methodology, analyzing the data and the results, or collecting the data as well, and analyzing the data and pulling it all together in a publication as well. And one of the things that I enjoy about it is that it's a group effort. So it could be independent, but I think the difference with this is that you're in a class, so you're working with other people. And so we have students who are taking sort of a research and biology class, and this is a class that we have in our curriculum. And through that class, they are spending anywhere from 3 to 6 hours a week working in the research lab on this particular project, which I'll describe in a bit. But here are the benefits. Of course, critical thinking skills. You're getting prepared for your career. You are literally hands-on. Even if you are not going to be a scientist working particularly in a research lab, students are building skills of networking. They are working alongside someone. You're learning how to be a team player. You're learning certain analytical skills. If you're using any type of methodology, and in our lab, we have technology that students are using to analyze the data. All of that makes a difference on how you present yourself when you graduate or you're applying for a job. And then sort of here is how it looks in our lab, of sort of a ladder to do that, where you're designing, you're learning experimental techniques, you're carrying out those techniques or experiments, and then you are also now analyzing the data. You are doing what I do. You literally are doing what I do, because I'm going to go sit down one day for real, and that you all are going to be next in line to take over. And so I really do work alongside my students, but also to a point to where I can be absent, and they can also carry out some of the same things that I would do as well. So here is a picture of the heart. And so here are the questions that students began to do for the project. So here is an adult heart that's younger and then age. And so here in this blue is what we call fibrosis. It's sort of like scar tissue. So if you cut your hand and then that skin needs to repair or heal, you get kind of what we call like a scab. But it's wound healing. It also happens in the heart. If there's any kind of damage or injury to the heart, like I mentioned before, it wants to begin to try to repair itself, not regenerating the cells, but it'll create this scar tissue. And that can be bad depending on how much of it is present. So students can analyze this, but that's one thing that happens as the heart ages. Another thing, if you can note, look how much larger the heart is compared to this younger heart. And then you could see some deposits, some fat deposits here. And then again, you can see the thickness of that heart has changed. And so we asked the question, how does this differ between males and females over time as they age? But then the big question is, how does this differ when women lose their estrogen as they go through menopause? So the students use an animal model to do that. And so we get animals very young at 2.5 months. They have an ovarectomy, so meaning they remove their ovaries. We also have a group of animals that does not have the surgery because that's going to be our comparison group. And then what we do is we give the animals a heart attack. We can do that by giving them chemicals to induce their heart to beat very, very, very fast, which is an example of hypertension. Or you could actually go surgically in and block off the coronary artery and you block the blood flow, which I mentioned earlier. So those are some models that we can do, but in essence, we induce heart failure. And so then what students want to know that, okay, after 1 month of having an ovarectomy and then you have a heart attack, what's going to happen to the heart? Then if you also have a group of mice where now if you wait instead of 1 month, you're now waiting 5 months, what's going to happen to the heart? And now if you even go further and say, we're going to wait 7 months after having the ovarectomy and then give the animals a heart attack, how are they going to respond? And then if you go as far as waiting 1 whole year after having the ovarectomy and then induce a heart attack, how are these animals going to respond? And if you know, you say, well, how does that compare to human years? It varies, but just in context, the lifespan of a mouse is about 24 months. And we are working on that now where we're looking at the whole lifespan. And so in this case, we're looking at kind of half of the lifespan of this animal being without its estrogen. And this is a little bit different because you have models where you can let the animals go until midway, then start to reduce the estrogen. But we're looking kind of early on to say if you were 30 years old and you have your estrogen removed, and now you go the rest of your life without it, what are those consequences to your heart? So we have another group of students who are doing something very similar where we have the ovarectomy, and I meant to say, so they don't have a heart attack, but actually what we do, so I'm going to give the results. So what we've seen so far is that after 1 month, they do okay with the heart attack. But then after we look at it, about 5 months later, they still survive. We see some changes in the heart function, the heart structure, but they survive. What was interesting and what we're starting to see is that as you increase that time of having the estrogen removed, they start to die and we have a higher mortality. And this is hot off the press from one of my students sitting right here in the front of her study, that we were skipping some time points because it's a lot of work to go down the line. But we happened to have this time point and we started to see that there's a critical window because we also had that time point already that they were starting to have a higher mortality. So the longer these animals are without their estrogen and then they have an injury. So if you just let them be with no heart failure, they live their lives, they okay. But it's when that mouse has an injury and they are long ways after having their ovaries removed, you start to see some severe differences and changes in how they respond to the heart failure. And then we have a group of students that are looking at the obesity factor to where these animals are long beyond middle age. And so we then started them on a high-fat diet. And so we're still in the process of this study now to see what's going to happen to the heart after feeding the animals for 3 or 4 or 5 months on this really high-fat diet after they've had their estrogen removed. And so here are some of the things that the students will do. So we do ultrasounds on the heart. So these are the readouts of the ultrasounds of looking at the function and the structure. So students don't do the ultrasounds, but they are reading the ultrasounds and analyzing the data and being able to tell me how is the function different. Then we do some histology, meaning we take the heart, we have to euthanize the animals, but we take out the heart and we can cut the heart in very fine sections and do sort of a pathology report. If you've ever heard of a biopsy where you take some tissue from the body and then look at it under the microscope, that's essentially what we're doing. And so here, the students are looking at if the heart is enlarged. And then in this situation, the students are looking to see if the heart has formed scar tissue after they've had an injury, and to what degree or what level. And again, how does that differ if you've had an ovarectomy or not, and you've had the heart attack, as well as the timing of your ovarectomy? How is that changing over the lifespan of the animal? And so how do we do this? So this is an old schedule. I think this semester we have like 35 people filling up the schedule. So we make a master schedule of all the students participating in the project. And some students volunteer, and that's fine if they volunteer. I don't give them a lot of hours. I'm all about getting credit for what you do. But the students who are taking it for a class, they literally spend that class time. It's not a lot of homework you do, so I do some calculations and say, if you're taking 3 credits, this is the amount of time you should be dedicating to research every week, as if you were sitting in class and studying for exams. And so we make a master schedule. And so how does this work? So for example, here's Sarah. That's Sarah right there when she was an undergrad. Now she's a master's student. But Sarah would come in at 8 and she will work. And then Patra would come in and finish up, and Amanda would bring it on home. So these experiments take a long time. And so you have one person starting it, another person coming in, and then another person finishing the experiment. And then the people that are alongside, you have Libby. Libby is working on something different from Sarah. So I showed you in one picture, there was this big red fluorescent stain. Sarah was working on that, but then Libby would be working on the other experiment to study what was happening with the scar tissue formation. And then another person, who's Adam, Adam would then be working on the other question of what's happening with the cardiac function. So everyone has a task that they're doing, but then also, because you can't stay there all day, you have to be able to work in sync and sort of tag team on these projects. So you have to have good record keeping. You have to know what the person before you is doing. And then after, when you come in the next day or your follow-up day, you have to go back and see what the other person has done. They have to have left good notes. This is how you work in the real world. You do not work in silos, but there might be some jobs. But for the most part, you are working with other people, and you are depending on them to get their part right, because it impacts the way you do your work as well. And so then the course assignments, I want to be sure I check time. Okay, we're doing good on time. And so the course assignments, so it is a course, and even though we don't have exams and traditional homework assignments every single day, I am grading them on 1, showing up, getting the work done, not accuracy. You can make a mistake. You can make a mistake. We try not to, but it's okay. You can make a mistake. We can do it over. A lot of times you learn from mistakes. So that's the beauty of this as well, in doing this type of research in this class. But one of the assignments that the student they have to do at the end of the semester is, you're going to have data. We're working 3.5 months. We have this kind of schedule. We're cranking out data. And so at the end of the semester, the students write a lab report, or I call it, they write a scientific report in sort of the style of a manuscript that you would read in a journal article, introduction methods, those types of things. But they're learning the process of science. They're learning how to analyze data. We have tons and tons of numbers. We may have about 48 animals just for one study, with multiple readings and data just from that one animal multiplied by 48. So they are fans, and they absolutely love just making spreadsheets and doing all those calculations as well. And I'm a stickler for that. Like, I need these spreadsheets ordered and organized. And so they're learning how to do all of that. The critical thinking, something goes wrong. Like, I had them yesterday, we were working in there. This is a new group of students and some older students coming back. But I said, you see all these numbers, you should be able to recognize these numbers. So we were reading through the sheet. You don't have to memorize them, but if you read this sheet with all these numbers, each animal is tagged with their ear, so they all have an identification number. And I said, so if we're looking at a group that has an ovarectomy for just 1 month, and then you have a group of animals that had the ovarectomy at 5 months, you don't want to get these animals mixed up. You don't want their data crossing. So if you're going through anything and you recognize that the 1-month animals, most of their numbers are 4,000, like 42, 44, but they all begin with 4. And then you're over here with the animals at 5 months, but most of their ear tags are 9,000. You should be able to pick up if you're looking at something and the 4,000 animal is sitting over here in the 5-month group. That is the level of critical thinking, having a sense of awareness that I want students to be able to have by working in the lab. And you do that just by spending time, paying attention to things, finding a method on how you're going to keep stuff in your brain organized. And that's going to be a good tool for as they go into their careers. This is big. So the science to society part, students write connections about their career path. So I ask everybody to say, hey, what do you want to be when you grow up? And most of the students are interested going into pre-med, some kind of pre-health, but I dig deeper to say specifically what kind of doctor. If you want to be a pediatrician, how does heart disease relate to pediatrics? Even if you want to be an orthopedic surgeon, why do you need to know about menopause for your patient? Because it affects bones and a bunch of other stuff as well. So they had to kind of do a deep dive and make those connections and do some research to see what was happening in those careers. We also talked about health disparities, social determinants of health, that cardiovascular disease, those numbers about those mortality rates, it's not even across the board. It will differ based on geography. So I showed you that it differs based on your socioeconomic status, and it differs based on your race and ethnicity. And so understanding why that's happening so that you can make informed decisions about when you are treating your patients or when you're having conversations about how do we fix this problem, understanding that as well. And then we had some career reflections on the skills. And so there are some guidelines from the National Center on Colleges and Employees. And so there are some guidelines of here are 10 skills that employees want students to have when they graduate college. So we took those 10 skills and I said, read through these and tell me, do you think you acquired these skills? How? In what way? And everyone had some, most of them had some, technology was a big one, that was a given, but some of them had different skills. And we even had a conversation, I think I'm gonna put Lindsay on the spot. She was saying, oh, it's so many people in the lab, because when she had her time last semester, she worked by herself a lot, doing some of the calculations and the analysis. But this semester, it's about 3 or 4 other people in there doing different things. And I said, so your career readiness skills might look a little bit different this semester because you have more people in there with you and you're engaging in a different way. So those were the reflections. And then here were some of the things from one group of students that they had. And I love this. So one student said that working in the lab, they learned how to just do some statistical methods and calculations. And this was really, really helpful for them. And then particularly because they were studying for the MCAT, that skill was necessary for the type of entry exam that they were going to take for medical school. This was probably one that I did not anticipate, but you have all these students with these connections, but one student was trying to get a job as a CNA, as you see in the cardiac step-down unit, and she found out that one of the students worked there and knew the hiring manager, so they got to talking, and guess what? She finally got the job in the step-down unit. So networking and making connections. So a student talked about growing up in a rural town, watching their family members struggle with health and disease, particularly the women in their families. So this was something that was motivating for them. The friendships that they talk about, is this the one they went out to Chick-fil-A? Yes, so they would go out afterwards and go eat at Chick-fil-A. I love to eat, so I love this. But it's people that you didn't know, and they would found out, oh, you were in my class, I saw you in class the other day. And so they probably would have never met outside of, or made the connection, because you're sitting in class, but how often do you talk to everyone that you're sitting next to in class, but now you're in this research environment and you're talking, they're discussing study skills. Oh, or if you had a senior student and then you may be a sophomore, oh, I took so-and-so for this class. Here's how you navigate through studying and taking exams. So those were some things that I didn't anticipate as well, outside of just doing the science. And then this is something that I'm going to talk about. And so we have students, there's a program in the Office of Undergraduate Research called Research Discovery. So if you are, if you have a federal work study scholarship, or if you have an academic performance scholarship, those hours that you use, like the APS scholarship, you do 75 hours a semester. In federal work study, you could do up to 200 hours a semester. And so doing those hours, you can take those hours and work in a research lab as part of your scholarship hours. And so some students didn't know that that option was available. And so I had some students work 2 years, freshman and sophomore year, with that scholarship in the research lab, and did a presentation, contributed a significant amount of work to the project in the lab. So that was really good as well. And as mentioned, I am in the Office of Undergraduate Research, and so helping students find these types of opportunities, again, it doesn't have to be in the sciences, humanities, arts, whatever your passion and interest, finding work with faculty members and asking these questions, developing new ideas, new protocols, new something, but just engaging and asking these questions and finding answers to those questions is something that I am passionate about. And I want to acknowledge my postdoctoral mentor, Dr. Krishna Singh, one, for the training. And so all that I do, my training, my organization comes from her. And that we are still close. She's still a mentor, even though I'm a faculty member now. She's still a great mentor. Her resources, and so a lot of the methods like the ultrasound machine is used in her lab as well. We do a lot of the surgeries sort of in her lab, so we still collaborate, and the students have gotten to know her as well. So she's currently the department chair of biomedical sciences. So she's been a huge, huge help to myself as well as my students. So could have not done this experience without her, as well as some funding from the American Heart Association, ETSU Research Development Grant. I did a fellowship as a junior faculty at the University of California, San Diego, in conjunction with the National Institutes of Health. So there was some funding to get some of this work done as well. And then the student faculty collaborative grants. So there are also grants that faculty and students can apply for to carry out these projects in the research lab. So if they're faculty or even there's their students and you're looking for faculty members, there's funding for projects that you can do, as well as some summer fellowship funding as well. And then that's it. Any questions? Any questions? Yes.
This is a little more off topic, but I'd be curious if you'd be interested in talking about the aspirin and heart disease from the 2005 study.
Oh, good. Yeah. So in terms of, so aspirin can be used to sort of as a to prevent heart disease. And so what's not known, again, is how those hormones have an impact on women versus men. And so one of the things they found is that it could be very detrimental if you don't think about dosage, body weight, all those types of things can come into play. And so those were some things that they were finding out, that there were some adverse effects in women initially in those studies without taking it into account, and how you recommend taking an aspirin or not. Okay, good. Yes.
Is there any research or information on how birth control, hormonal birth controls from a young age, could affect the issue with hormones if you have such a high concentration of these hormones at a young age and then stop taking them, how that could affect your heart?
So I don't know all the details and the parameters, but one of the things with birth control is that the birth control can have an impact on the arteries that I was mentioning, whether they constrict or relax. Blood clotting, they can have impacts on that as well. Now, what those long-term effects are in terms of prolonged cardiovascular disease and even through menopause, if you have those early on, that I do not know. Hence, one of the reasons why we're saying a lot of that lack of that information is not available or is missing. But good question, very good question. Is anyone? I have a question. Who in here is involved in doing undergraduate research?
I'm trying to.
So you're trying to? Will you stay after and talk to me? But okay, good. If anyone is interested, I'll stay around and answer some questions if you are interested in how to get involved. Good. Any other questions? Thank you.